pituitary, which is this one right here, 1.17. Hit accept. Are we recording? Yeah. Hit accept again. Just like all our other scans, we've got a localizer. Nothing to do, just save it. Talk to your patient. Okay, this first scan is going to be about 30 seconds long. And hit scan. And get yourself a break for about 20 seconds. Okay, we find the scout acceptable, so we go into the calibration, hit setup. It's pretty straightforward. You just have to click right in the middle of either of these two windows. It doesn't matter which one. And then once you've done that, you can save it, talk to your patient again. This scan is also going to be about 20 seconds long. Please hold still. Scan. No break this time. Hit sagittal T1, hit setup. Now I'm going to move the graphics toolbar out of the way. I'm going to do my setup. I'm going to make sure that I have these scout images exactly the way I want them. I want to try to find the best view I get of the posterior of the brainstem here. I'm going to make sure I can see the falx here and I can see the falx over here. Now I'm going to throw down, and because it's a sagittal, I'm going to throw down in the coronal plane. So I just click once. I just want to make sure that my slices are going from left to right, which they are, and then I basically, all I want to do is kind of put it roughly where it belongs. And now I want to angle in all three planes. I angle this in this plane, and I angle in this plane like that, and I don't have to angle in the sagittal plane. So I angle first, and then I center, and so I can hit the minus so I can see what I'm doing, and I want to put the crosshairs right in the middle of the brain. So if the brain was like an egg with a bite taken out of it, I want to put it in the middle of the egg like that. So that looks really good. Next thing I want to do is coverage. My coverage looks pretty decent. I can maybe add one slice if I wanted to, and then drag this over a little bit just to make sure I'm going from the edge of the brain on one side to the edge of the brain on the other side. This is a regular T1. So I can use this to basically auto TR. It's basically a forced move. So I want to make sure that my TR is between 400 and 800, and then I come over here. I'm going to drop my frequency to 256, 192, and 1 next, giving me a 51-second scan time, which works for me. So I'm going to save that. Okay, this scan is about a minute long. Hold very still, please. You're doing a great job. I'm going to bring up my sagittal, or my axial, sorry, it's an axial T2. So once again, I'm going to go through and I'm going to do my setup, making sure that I can see all the relevant, lovely anatomy that I need to see. Falx here, and then posterior of the brainstem right there. So now that I'm happy with my setup, I'm going to throw down, because it's an axial, I'm going to throw down in the sagittal pane. I'm just going to click somewhere in the middle of the brain. And again, I want to make sure that my slices are going the correct direction, which they are, from inferior to superior. So that's great. And then I may also make sure it's an axial, which it is. So the next thing I'm going to do is angle in all three planes. Well, I'm going to start angling in the sagittal. I want to make sure I try to match up the angle, the line of the posterior of the brainstem first, kind of like that, somewhere around there-ish. Looks good. I drag this back into the middle, and then I'm going to angle in the coronal plane, and if this is slightly rotated, I can rotate it in the axial plane too. Since this is an axial, the next thing I'm going to do is I'm going to just hit the minus key, and I just want to basically stick this crosshair right in the middle of the brain. So this is the brain, Just put the crosshairs right in the middle. Usually winds up being somewhere right in the middle of the pons as well, if you want to look at it on the sagittal. Next thing I'm going to do is coverage, so I want to go from the top of the brain, something like that. And I can see right here, this is the base of the skull, so I want to have a, a slice, maybe two, below the base of the skull on that side. So that looks really good. So I'm going to go ahead and do my frequency. My phase is correct. Take the next down to 1, and I've got a 1 minute scan. So let's do the TR. See, we'll roll the bones. This is not automatically auto TRing. You have to select it. So the only selection that's appropriate is this 4,389, and that even makes it a 40-second scan. So it's super duper fast. So we're going to save that. Okay, this next scan is about 40 seconds long. Please hold still and scan. Now my next scan is a coronal. So same thing as before. Want to do a setup. Now I don't have to, because I already have a sagittal. If I want to, I can load the sagittal that I've already acquired into this window, which is going to give me a much better view of this angle right here, which is again the posterior margin of the brain stem right there. So I can do that, and if I do that, it's going to give me the angles off this from before, so it makes my life a little easier if I do that. Although this is wonky. I don't know what happened here. So we'll do that. Want to make sure that my centering, I want the centering to be so that basically this blue line, the corpus callosum, which is right here, sits right on top of this blue line, just like that. It looks good. Want to make sure I cover from the posterior of the brain to the anterior of the brain, something like that. I do not need to add 2 or 3 slices into the frontal sinus, not necessary, but you do want to cover all the brain tissue like that. All right, next thing we're going to go ahead and frequency 256, 192, 1 next. This is a T2, so let's see. I guess that's my only choice right there, and that's properly optimized, 1 minute long. I don't know why this contrast is selected. It shouldn't be. Let's save scan. David, you doing okay?
Yeah.
Okay, great. This next scan's about 1 minute, 20 seconds. Hold very still. Now we have 3 thin scans. Unfortunately, even though we've already plotted a coronal, we can't copy off of from a thick slice to a thin slice. You just can't do it. Let's set up. Now for this, I will load any prior scans that I've already done. The reason is because these things require as much accuracy as you can possibly have. So I want to be able to see the anatomy to with the best resolution possible. All right, so I'm going to load. I've got the sagittal in here. I can also load the axial T2 in this window right here. So I've got the best possible resolution to be able to see the anatomy I need. Now, the key anatomy for this particular scan is the pituitary gland. The pituitary gland sits in what's called the pituitary fossa, which is right here, in what's called the sella turcica. Sella turcica means Turkish saddle, and it's basically this little cup right here. The easiest way to find it, I find, is if you find the clivus, which is this triangle, it's just follow it up and you're going to be right there. You can also see the anterior portion of the corpus callosum is sitting right on top of it. So it should be pretty easy to find. Now David has a fairly generous amount of stuff in his sella turcica, probably more than most people, but it makes it really easy to see, but it's still very easy to see on most patients. So I can see it here. I'm going to window. Unfortunately, because this sequence has more signal than the Scout, if I adjust this to a proper window like this, this gets to be too bright. If I want to keep that from happening, what I can do is go to this, they call this a caret, select down and uncheck this update all. And then when you do that, I'll be able to adjust the window level in each of these windows independently from one another, and I don't have to worry about. Okay, so this is a coronal, pretty straightforward. I'm going to throw down in the sagittal plane, and I'm just going to click somewhere near the pituitary gland. I'm going to check immediately that I am scanning a coronal, which yes I am, and I also want to make sure that I'm going from anterior to posterior, which I am. Now this pack of slices I'm going to angle exactly like the other coronal, so I'm going to come back here, make sure that the lines are parallel with the posterior margin of the brainstem, and then I'm going to put the sella turcica right in the middle of this pack of 16 scans, like that. Pretty much that's it. The only other things you have to do is you want to make sure that you are lined up accurately in the two other planes. And this is kind of, it's really hard to see. The sella turcica is right in here because you can see the basically the carotids coming in on both sides of it, but it's really hard to appreciate in the axial plane. It just is. So it's really hard to use this to line up with. So I try to grab something where I've got some fulks to work with, and then I just basically turn it so it's nice and perfectly straight. There we go. Just like so. Now, because we've got so much of an angle on this, you're going to wind up with lines instead of the box that you're used to. The scanner just does that, and I don't think it's a good idea. So what you have to use is you see these tick marks going down the middle of the image. That's what you have to use to make sure that the scans are going to come up perfectly straight. Is you're going to use these tick marks, and you're going to have these tick marks going all the way up and down the fulks, and that's how you know the scan is straight. Okay, so that's pretty much it. Nothing much to it really. It's just doing what you've done before, only doing a very thin amount of it, just right over the pituitary fossa. So we're going to do 256, 192, 1 next, and I'm going to click on here. I'm going to pick a TR that's appropriate. The only one I have is 3177. Boom. Uh-oh. Did somebody lose it?
Yeah, I ran out of space outside a little bit.
Okay. So you just hit save. This is very short. These scans would normally be about 3 or 4 minutes long. Making them 38 seconds means they're going to be really grainy. All right, this next scan's about a minute. You've got about 4 minutes left and you'll be done. All right, so the next thing we're going to do is we're just going to copy, because this is a coronal thin, this is a coronal thin, which means we can copy.
Cool.
There's
Cool.
Cool. Yeah, cool. So we're going to hit setup. We're going to go to copy, and I'm just going to select this, and I'm going to hit accept. And it should darn well come up the way it did on the other, exactly the same. So all I have to do is my numbers. 256, 192, 2 next, and then we're going to go play with our TR. This 517 looks good. It's about a minute long. Perfect. Save it. Now we're going to go do the sagittal thin. Now, unfortunately, the sagittal thin is, you can't copy it. You have to prescribe it fresh. So what I'm going to do, I don't really have to load the sagittal into this window because I don't need the high resolution, because I'm plotting a sagittal, and the sagittal isn't very much used to me. So I am going to go here, and I'm going to see if I have a coronal to throw in there, and oh boy, I do. So I'm going to put the coronal in there, like so, and then I'm going to come up here and I'm going to put that axial that I have back into this window right here. So I have 2 high resolution images, and this one I don't really care about. So because I'm doing a sagittal, oh, I can start this next one. Okay, this next scan's about a minute and a half. Because I'm plotting a sagittal, I like to plot them off the coronal. You can actually do it off of either one, but I just throw it down in the coronal because that's how I roll. All right. So again, we're going to make sure that this is in fact a sagittal, which it is, and also we want to make sure that the scans are going in the correct direction from left to right, patient's left to patient's right, and it is. So we're golden there. This protocol doesn't have any tricks. It doesn't bring up things in the wrong direction. doesn't bring up, you know, any scans that are, it should be an axial and comes up in the coronal plane. It's very straightforward. There's no tricks to this one. All you want to do is make sure that you line up with the falks. You can see if you can find the cella. Which is pretty hard to find, but it's right about here. That's probably it. That's probably what's in his cella right there. So you make sure that that's nice and straight. And then this one's very important. You want to make sure that you get this one nice and straight too. So you just kind of angle it like that, line it up. Perfect. Now I'm going to center. The coverage is the coverage. You're just covering, you're doing 16 slices. So that turns out really nicely. And now all I have to do is my numbers. 256, 192, one next. It's a T1, so the 656 looks good to me. So we'll accept that. Okay, David, this is our last scan. It's about a minute. You'll be all done. And again, this field of view is small. It's 18, which is much smaller than the 22 or 23, sometimes 24, that normal MRIs of the brain, that's the normal field of view. So you're really kind of tight here. And if for whatever reason you clip the brain a little bit on one side or the other, it doesn't matter. You know, this is the focus for the radiologist right here. But if you can get all the brain, all the cerebrum in the scan, why not? Why not do that? So I try to make sure that I get as much of the brain as I can, even though this is the area that the radiologist is interested in. All right.